Hello, everyone. I wanted to give a quick update, especially for all you prayer warriors, so you can know how to be praying. I started having some pretty severe pain in my arm a couple of weeks ago, and it got to a point where I had to reach out to my medical team. So they ordered an x ray, and it looks like the bone has gotten worse. This is the area where the main tumor is. My PET scan back in December revealed that there were other mets throughout my bones and some in my lungs, but the one that's really giving me trouble is the one in my arm. And because the tumor in my arm is so aggressive, it's causing damage to the bone. And the x-ray showed that although the bone is still intact, there is a small break, which puts me at risk for an even more severe break. So we did a full CT scan just to make sure that other areas in my body were not progressing. And we are grateful because it looks like all those areas are still stable. That's good news. So we are going to begin really tackling the issue in my arm, and I will begin targeted radiation sometime next week. Surgery is an option, but we are trying to prolong that, and if radiation can shrink the tumor down or make it completely go away altogether, then we can avoid it, which would be great as well. I've also been dealing with some pretty elevated blood sugar, which could be steroid induced. That's not uncommon for long-term steroid use, and I am tapering off of that, so I'm hoping that we will know more about what that is in the coming days. But my oncologist did mention at the beginning of my treatment with the immunotherapy that sometimes when the immune system overreacts, as it did with me with the colitis, and attacking the good tissue and the organs, it can attack the pancreas, which results in type 1 diabetes. So obviously we are praying that is not the case. We are also navigating what our next treatment options are. So those are all ways that you can be praying specifically for us as we walk through this. And again, we're so grateful that you are on the journey with us.